Have you ever stopped to think about what's actually happening inside your bones, like right this second? For millions of people, there's a silent process underway, one where our internal framework just slowly gets weaker. So today, we're going to pull back the curtain on this hidden condition, osteoporosis, and the really remarkable technology that lets us peek inside and see it before it's too late. So take a look at this. What you're seeing, it's not a sea sponge. It's actually a magnified view of human bone that's been ravaged by osteoporosis. See those huge hollow spaces? That's exactly what happens when the very framework of your body starts to lose its density. It's a completely silent process, but that fragility it creates, well, that's a very real danger. And this isn't just an individual problem, not by a long shot. This process is so widespread, affecting so many people who don't even know they have it, that experts are now calling it a silent epidemic. So what is osteoporosis, really? Well, at its core, it's a disease of low bone mineral density. Think of it like this. Imagine a building's foundation slowly losing its concrete. Your bones become less solid, more brittle, and just way more likely to break from something as simple as a fall or even a minor bump. The sheer scale of this is just staggering. We're talking about tens of millions of people in the US and Europe alone. And you'll notice there's a really clear gender disparity. Osteoporosis hits women 4 times more often than men, which makes it a major public health issue, especially after menopause. And here is the absolute most important thing to get. You don't feel your bones getting weaker. There are no aches, no pains, nothing. For so many people, the very first symptom is a sudden, totally unexpected fracture. That's why we call it the silent disease, and that's why catching it early is everything. So how in the world do you fight an enemy you can't even see or feel? Well, first, you've got to understand it, and that means we need to zoom way in and take a look at the constant microscopic battle that's being fought inside your bones every single day. This is such a great way to think about it. Your skeleton isn't some static, finished thing. Nope, it's a dynamic, living tissue that's constantly being broken down and rebuilt 24/7 for your entire life. It's a nonstop construction zone. So here's a look at that construction crew. You've got 2 main players, the osteoclasts. They're the demolition team, clearing away all the old, worn-out bone. And then you have the osteoblasts, who are the builders, laying down new, strong bone. In a healthy skeleton, this whole demolition and rebuilding process is in perfect balance. But as we get older, and this is especially true for women after menopause when estrogen levels drop, that perfect balance gets thrown off. The demolition crew starts working overtime, and the building crew just can't keep up. The result? A net loss of bone mass, year after year. So, if this whole process is silent and totally internal, how on earth do we measure it? That brings us to the key tool in this fight, the DXA scan. The DXA scan is, without a doubt, the gold standard for measuring your bone density. Basically, it works by sending 2 very low-energy X-ray beams through your bones. Then, a computer analyzes how much of each beam gets absorbed, which allows it to calculate the density of your bones with incredible precision. And if you're picturing some scary claustrophobic tube, forget about it. This is what a modern DXA scanner looks like. It's completely open. You just lie down on a padded table for about 5 minutes while this arm passes over you. It's totally painless and non-invasive. Of course, whenever people hear X-ray, they immediately think of radiation. But the dose from a DXA scan is incredibly small. We're talking just 0.001 millisieverts. To put that in perspective for you, it's about 100 times less than a chest X-ray. It's actually the same amount of background radiation you'd get in just a few hours of a normal day. It is extremely safe. Okay, so you've had the scan, now what? The machine translates all that data into one single, crucial number that tells you pretty much everything you need to know about your bone health, and that number is called your T-score. Your T-score is really all about comparison. It measures your bone density right now and compares it to the standard of peak bone mass, which is the strongest your bones will ever naturally be. For most people, that happens around age 30. So it's basically telling you how your bones today stack up against the absolute best-case scenario. The results are super easy to understand with a traffic light system. First up, we've got the green zone. If you have a T-score of -1.0 or higher, that means your bone density is normal and healthy. You've got the green light. Then there's the yellow zone. This indicates something called osteopenia. Now, this isn't osteoporosis yet, but it's absolutely a warning sign. It means your bone density is lower than ideal, and it's a signal that you should probably start taking steps to prevent any more loss. And finally, we have red, a T-score of -2.5 or less. That's the clinical definition of osteoporosis. This means your risk of a fracture is significantly higher, and it's a clear signal that you need to work with your doctor on a treatment plan. But here's the thing. That number, your T-score, it's not the end of the story. It's the starting point. Getting a diagnosis is the very first step in creating a really powerful action plan. And this is what's so powerful about it. Your T-score is rarely used all by itself. Doctors often plug it into tools like FRAX, which combines your bone density with other risk factors, things like your age, weight, and family history. This calculates a highly personalized 10-year probability of a fracture, giving you a much clearer picture of your actual risk. Based on that whole picture, your doctor can then put together a clear action plan. It's usually a two-pronged approach. On one side, you have lifestyle changes, making sure you're getting enough calcium and vitamin D, doing weight-bearing exercises, and quitting smoking. And on the other side, if it's needed, there are really effective medications that can slow down that bone demolition crew, helping you protect the bone mass you have. So while bone loss happens silently, the good news is we have the tools to see it, to understand it, and most importantly, to act on it. Your bones are the foundation that supports your entire life. Knowing their condition is the first step to protecting them. So the final question really is for you. What's your plan to keep that foundation strong?